Thanks a lot for the introduction, Daniel, and thanks a lot for the committee organizers for inviting me to this event. I'm very honored to be able to present today. So as you see from my title, I'm going to be focusing on how did the health disaster lead to economic and social crisis with the pandemic. So what am I going to cover today? So I'm going to mention very importantly that I'm going to speak through a lens of health systems and health policy. I will mention briefly the independent panel, which some of the speakers and the organizers of this event were part, and I was helping with conducting the research. We will talk about recommendations that we made at the national responses, and I will spend a bit of time talking about some of the health systems challenges that would also be helpful for the second session. And then finally, how can we reimagine the health systems of the future, and what type of work can we do next as researchers? So before we move into what went wrong, very important to highlight, and I think sometimes we forget, that for pandemic preparedness and response, there are different phases. And we actually had an incident, which was COVID-19, and all countries went into the response phase. But it seems that the countries and also some governments have forgotten that we do have other phases that we need to take into account, and that actually are really important. So now we have the recovery phase. You can see there we also have the prevention and mitigation phase, and then the preparedness phase that will lead us to be prepared for the next pandemic. And what is very clear now, and I think most experts agree, is that we are lagging behind in this phase of preparedness. Now, I just wanted to highlight a bit where my work is coming from. So when, I'm sure you all can think the moment when everything started where you were. In my case, I was in Singapore at the university, and it was very clear that in Singapore, very quickly, we soon realized that we had to put measures into place, and my whole team was moved to doing research, and as I said, from a health system perspective, and you can see there, we were very keen on providing evidence in different countries, particularly on how the system was resilient or not, and providing recommendations. So one of the key papers that we published that you can see there, the title reads, "Are high-performing health systems resilient against the COVID-19 pandemic?" And this was before the closing of most countries. And we were already suggesting that perhaps some countries, such as European countries and the US, would not be prepared, and we were already giving recommendations from Hong Kong, Singapore, and Japan. Now, very clearly, when we were starting with the independent panel work, we were looking at the Global Health Security Index, some other indexes and indicators, and what we also realized, and here, during my presentation, I'm also going to be critical with ourselves, researchers, so we can learn lessons for the future also. So we were very clear that some of the indexes that were designed to suggest whether countries were prepared or not, they also failed in the sense that they were not able to predict, they did not have this predictive power. They were not able to predict which country was better prepared or not. And you can see there in the map some of the countries that were highlighted first and second. I'm not going to name any of the countries, but you can see that they were not as prepared as it suggests. With the independent panel, it was very clear for us that we wanted to collect the evidence, and I focused very much in collecting evidence in 28 country responses. But I also want to highlight, and I'm sure Anders Nomstrom will mention that for us was very clear also to document the chronology of the response, and we identified all the crucial moments in the first 3 months to suggest what went wrong. So very briefly, what we identified that went wrong was, first of all, there were delays at the international level. Secondly, there were delays at the national level and some of the key institutions, but above all, what we identified also was that most countries, and there are some exceptions, they had a wait-and-see approach, and they took more than 1 month to react. And that was one of the key components that we want to avoid for future crises. Now, you see here the analysis of the 28 countries. You can see we had a variation with all the continents included and different mortality rates and different sizes. And when people ask me, so what are the countries that did best? So I want to show the next slide that highlights how difficult and how complex it is to suggest which country did better or not, because it depends on multiple factors. And we also realize the importance of context. So you can see there some of the key components, so which control strategy, governance approaches, what public health measures they chose, and the inner and outer context are key. So we need to consider that when we look at which countries did well or not. Having said that, we were able to identify some key aspects. So here we look at a paper that we published in Nature on health systems. And one aspect that I want to highlight of this paper, while we go through service delivery, governance, and all the different components, we also highlight very importantly that activating our response, readiness and being prompt was key. Being able to adapt your health system was also very important, and then being able to preserve your functions. And a key component that was highlighted in all the countries is that being able to reduce vulnerability of those that needed help in those moments. The next slides highlights, and for me this is one of the most important slides. It's very crowded, but I want to highlight some of the key components that we identified for high-performing national responses. So the first one, we identified that. And having said that, while we did identify some patterns, there's always exceptions. So it's very difficult to conduct an analysis of this type. So we did identify that having prior experiences in pandemic preparedness was key, and having these plans, but equally important was implementing those plans. So only having a plan was not sufficient. What became very clear, and I think this is a key message for moving forward, is that leadership and trust in the decisions was key. And what we know now is that many countries did not show great leadership, and that had a really influence in the response. And together and coupled with leadership is listening to scientific advice, trusting scientific advice. And when we look at leadership also, we identify that those leaders that were empathetic, they were willing to listen, they were willing to change track when errors were identified, and they were even willing to ask for the population that they had made a mistake, recognize mistakes. They actually, that had a very positive impact in the sense that populations trusted the leaders, and therefore they trusted the measures that they were implementing. Of course, having a strong health system is key, and we know particularly in Europe, with austerity measures, some countries were very depleted. And then also, in some countries, public health has been underinvested, and this is a key aspect. Having said that, those countries that introduced, and again, I emphasize, promptly, proactive testing and contact tracing measures, and those that had quarantine and isolation facilities very, very promptly, they did much better than others that took much longer. But the key aspect for us is also social and economic support, which means that providing social and financial protections for communities and those that are vulnerable, and also for small businesses, and for vulnerable populations to be able to fulfill the public health measures that were implemented. Now, looking at recommendations, if you see, when we did this report, we were focusing very much in terms of the react phase. So we designed this iceberg, and we were looking at the top. But we were saying that we really need to pay attention to the bottom of the iceberg. So we need now to prepare our systems. We need resilient health systems. We learned that we need socioeconomic support and public health measures. We need to strengthen UHC. And we need to monitor and evaluate our responses. We emphasize the importance of monitoring and evaluating, and some countries have done it, but many others have turned the blind eye and moved on. And we have to emphasize that we need to learn from these experiences. And then we even refer to at the bottom of the ocean, the need to transform societies. Unless we build equitable societies and shift mindsets, we won't be able to be prepared in the future. Just to highlight that this work we conducted, we've got several papers that will be discussed in these sessions. We've got some on vaccines that we'll have El Storel talking about it. But we also were very key of the importance of involving the community, and also discussing the issue of trust, and also discussing those components that are normally left behind and that they were not included during the pandemic. So here you can see we have a paper only talking about those qualitative components for evaluating pandemic responses. And by that, I mean, we need to look at cross-border cooperation. Most of the time, we focus at the national level, sometimes at the local and local level within the national system. But it's been very difficult to make those connections. So we need to learn from other countries, and we also need to link the national with the international level. Of course, I've already said the importance of national governance, leadership to guide the responses, and also a key component, and I think it's a learning lesson that we did not take so much into account at the time that we were doing it. We were looking at mortality rates, but right now I think we want to do another analysis, and we need to look not only at mortality rates, but how societies were left after the pandemic. Are they more divisive? Are they more cohesive? These are very important components. And of course, how were economies left? We need to do much more work on that. And what we all know about, how it has affected the mental health of the younger population, the older population, how has it left our society? So I think we need to take that into account. And above all, you can see there, we need to take special attention to inequities within countries. So just to give you an example, Singapore was very successful. Everybody considered it to be one of the best countries in terms of responding to pandemic preparedness and response, but they did not pay attention to migrant populations because it's an area where it was neglected. So this is an area where when we want to look at inequalities, these groups need to be included, and they need to be within the system, and they need to be provided with care. This is only an example of what I refer to as paying special attention to inequalities. So now, how can we prepare our health systems? I'm just going to give a couple of ideas, because I know we have a session afterwards, but this was coming very strongly from our analysis, so I think it's also worth mentioning. So first of all, we've got if we really want to have resilient health systems, they need to be complemented with a multi-sectoral approach. We have to move beyond health. We've said that I'm a health systems researcher. We do need to move beyond health and consider economic and social components. We've learned of the importance of a whole-of-government approach. I cannot emphasize more often good leadership. And the next step, we also need to take care of our healthcare professionals. We are very worried that we need much better planning because a lot of them want to leave the profession, and many countries are finding it difficult to recruit them. So a lot of effort needs to be put into that, and also taking care of their own mental health. Of course, we will have a session on medical products, but we need to design a system that is equitable. We are very clear that we need an integrative approach. We need to integrate primary health care with secondary care, but also with public health and also with social and home care. Many countries really struggle on that front. And then we need to open a debate in terms of appropriate financing for health systems. And finally, this idea of partnerships. We need a co-production approach where the community is much more involved and not in a tokenistic manner. We need approaches where we truly engage patients, healthcare professionals, and communities. As I said, governments need to have a national, subnational, and direct resources to health and to take into account social and economic conditions. My final 2 slides, just to highlight that we are also proposing reimagining. This is a very big opportunity that we have now. And I tend to be very optimistic in the sense that we need to reimagine our health systems. And I do think that most countries have realized that we need to reform, we need to strengthen. And this is an opportunity for health systems researchers. So I think we need to really think together, how do we want to reimagine the health systems of the future? And there I make some proposals that we wrote for the Health Systems Alliance, which is merging this idea of health systems with health security and healthy populations. Again, a much broader perspective of health, discussing it in the context of systems for health. The role of scientific advice. The role of scientific advice doesn't stop with the phase that I've mentioned. We have to continue working. So as researchers, I know we are all tired that in a way maybe we want to look at other topics, but we now have this opportunity to reform our health systems and also to prepare for the next pandemic and to conduct the research that will guide us better for future risks. So in that sense, I just want all of us to think a bit, how do we want to contribute? How do you think we can contribute? In my case, and together with some of our speakers today, including Professor Kaczynski, we thought that the best way that we could contribute in our work is now, I've said at the beginning, we failed at evaluating and monitoring which countries are prepared or not. So why not propose a new way of monitoring and evaluating, but this time doing things differently? Rather than a top-down approach, why don't we do a bottom-up approach with grassroots indicators, involving the community, involving patients, listening to all the stakeholders, and coming up together with some solutions. So with that thought, I leave you thinking about how you can contribute, and I thank you for your attention. Many thanks.